Okay, now we're going to do some hip exercises. Now you can do them standing, but really they're not terribly effective if you don't have a resistance band or some weights or gym equipment. So we're going to do some floor exercises instead, so we can use gravity to actually work those hip muscles. So could you have a lie down on your side for me, Alex, please? So if you lie on your right side, that's it. Okay, so we have him lying on his right side so that we can work the left hip. Obviously, if you want to work the other side, you turn over and you'll be working the right hip. So we're having on 2 pillows just to make sure his neck's in a comfortable position. When he's doing his exercises, he doesn't get a neck problem. We also have to be a little bit careful with his lower back. So to make sure that his lower back isn't twisting when he's doing these exercises, we would suggest that you bring your arm over here and keep it down in this position to stop your back from rotating. Now, the next part of the exercise is to bring the knees up. So you've got a 45-degree angle between your hips and your knees, and 90-degree angle between your hips and your feet. So this is the starting position. Okay, we're going to do a clam first of all. So can you bring this knee up for me, please? Keeping the feet together, the feet must touch all the time, and then down you come. Good, just brush the knee, and up you come again. Very good, and down. Now we're going to do a toe tapping exercise. So bring the legs up so they're apart, and then tap the foot in front, and then behind. So do that for me again. Very good. As close to the ankle as you can, please. Very good. And down. And then you're going to straighten the leg, straighten the knee. And you're going to slowly raise the leg in this neutral position, just 1 inch or 2, keeping the knee nice and locked. Very good. You need to lock the knee in this. Good. And then bring the hip forward so it's flexed. And again, externally rotate. So turn the foot upwards, keep that ankle nice and locked, and the knee nice and locked. That's it. Very good. You can see the movement here. It's all coming from the hip. Good. And now extend the hip, bring it backwards, please. Again, keep the knee nice and locked, the ankle's locked here, and you're going to turn the leg upwards. There we are. You see a big rotational movement at the hip. So try and extend that a little bit more if we can. And that's it, and bring it round again. Very good. Once more. Excellent. Okay, and then back to the normal position. Okay, now you have to do these 5 exercises consecutively, and you're going to do 3 sets of them. First of all, we're going to start you off on 3 repetitions of each exercise, and then 3 reps. But the secret of this is there is no rest in between the sets, and there's no rest in between the repetitions either. So we're going to do 1 set, 1 full set now. We're going to do 3 of each exercise in 1 set, but you would have to repeat that 3 times without a rest. So let's go for that now, Alex, if we can, please. So the clam, 1, 2, a bit higher, 3, good. Toe tapping, as close to the ankle as you can, 2, 3. Lateral raise, extend the knee, lock the ankle and lift up and down, 1, 2, 3. It's a very small movement, and raise the leg and externally rotate, 1, 2, 3, keep that knee locked and extend the hip, so bring it backwards, keep that knee locked and again externally rotate, 1, 2, 3, then back to the clam, and you repeat immediately. No rest, go straight through to the 5 exercises again, and then a 3rd set. Once you're good at this, you can get this up to 3 sets of 10 repetitions. It's going to be a lot harder than you think. This is going to make this quite tired. The muscles around the hip will be tired. Once you've done the 3 sets, turn over, repeat on the other hip. So once you've mastered this, we can then move on to bridges. So can you lie on your back for me, please? Okay. So, okay, bring your knees up so your feet on the floor. That's good. And the knees are about 6 inches apart. That's excellent. Now once you pull your tummy muscles in, nice and gently, that's good. And tighten your buttock muscles. And now push down through your feet and raise your bottom from the floor. That's going to work the muscles in your thighs and in the gluteal muscles in here. Okay? And if you can see now in this position, unfortunately, he's now putting a strain on his neck. His chin is heading towards his chest, and we may have a neck issue here. And his legs are now opening up, so that's too wide. So down you come. So let's just change that. So we're going to take one pillow away. That will protect your neck. So down you come. So that's 2 pillows when you're lying on your side, 1 pillow when you're lying on your back. We want you to concentrate on the distance between the knees. This is really important. It's going to make the gluteal muscles work a lot harder, strengthen your hips a lot more. So let's do that again. Tighten those toe muscles. Good. Pelvis is tilting slightly. Clench the buttocks and push down through the feet, maintaining this distance. Up you come. Keep maintaining the distance. The knees are starting to go a little bit wider. Bring them in. That's fine. And as you can see, the neck's a little bit more comfortable there. And then slowly down. And that's a bridge. You can make that a little bit harder by repeating the movement. So up you come, tummy in, clench the buttocks, push down through your feet. Up you come into a bridge position. That's good, high as you can, maintaining that distance. And then down you come, slowly. As soon as you touch